I think everybody wants to get off that hamster wheel of, seeing each individual patient on a, rapid fire basis kind of thing, and get into where we're providing good care for the populations that we serve. And I think, that payment system seems to be transitioning very rapidly. And so the faster we get into a clinically integrated network and start working together to manage those populations, the better. Our health system actually recognized the need for the clinical integration a couple of years ago, starting to watch the nationwide trend of moving from fee-for-service to value-based payments, and realizing that we had to integrate some of what the physicians were doing from a quality standpoint. And with that came some discussions about how we could start to integrate on a small scale, both in our community here in Bradford and then our sister hospital in Olean, New York as well. My particular practice, we've looked at offering some of those types of wellness services, contracting with dietitians and, health coaches and things like that to provide wellness to a population. But when you get into chronic disease management and managing some of the tougher conditions that are out there, it's more than what any small practice could handle. It's more than what actually a lot of large practices can handle. So I think, going forward as we start to delve into this clinical integration, it is a lot of, unfortunately, investment on the front end to get the resources you need to do this right. Again, I think, at least in my opinion, getting the data to the providers themselves, the physicians and nurse practitioners and PAs that are out there seeing the patients, as well as the healthcare team, you have to be able to synthesize the information that our systems are now collecting, and also the data that the insurance companies have, the hospitals, the pharmacies, all that kind of stuff on our patients. And I think, there needs to be some resource to fund that kind of stuff up front, as well as start to educate the physicians. In our region, I'm fortunate that our health system helped to educate me on the topic, but I think a lot of providers in Pennsylvania probably aren't educated as far as, what's happening in this change. And I think that piece of it's going to be an important resource too. As far as the investment goes, I think that our health system has helped to capitalize our efforts up here, and I think there's probably other systems across the state doing that. But there's nothing integrating all the doctors in the state, or at least even regionally in the state. And our system up here is a very small system, so it would be helpful if we could join into a larger system and help get even more resources into what we need to accomplish the task we're trying to do.